Another big problem now, hooked on prescription painkillers. Opioid abuse here in the islands, as it is across the country, is on the rise. Jen Benitez tonight looks into what's being done to keep that problem from getting worse.
Hydrocodone and Oxycodone. They are two of the most commonly abused opioids in Hawaii, according to emergency room Dr. William Scruggs. He says the problem has grown significantly worse in the last 10 years. I sat down with Dr. William Scruggs, chair of the Castle Medical Center's emergency department, to find out how often they treat opioid-related cases in the ER.
Every emergency department in the state sees this every day in one way, shape, or form.
And the people being treated come from every background and age group.
The spectrum, really. The people who are most at risk are actually in their 50s. And it tends not to be a group of people that we identify with drug abuse. White males in their 50s in Hawaii are the most at-risk group for overdose and injuring themselves with these medications.
With emergency rooms and doctors seeing more opioid-related cases here in the islands, I wanted to know what's being done about it. Senator Roz Baker has been actively trying to combat the problem, helping to introduce new legislation to stay ahead of the curve. One proposal would allow pharmacists to fill prescriptions for a drug that can save the life of someone overdosing.
Naloxone is what we call an opioid antagonist. So if somebody is in jeopardy of overdosing, somebody has taken too much, a shot of naloxone will get them out of it.
Another bill addresses the shortage in resources for people dealing with addiction.
If we had more substance abuse counselors, if we had more folks in the field who knew how to deal with substance abuse disorders, knew how to help people get onto medically assisted treatment and to get into recovery in that way.
Senator Baker says solving the problem requires a three-prong approach: education, resources, and services. She says they are also looking into other ways to manage pain, including medical marijuana. Right now, 2 companion bills in the House and Senate promoting medical marijuana continue to move forward.